The number one cause of injury that we see coming into the office here as marathon season begins in South Florida is increasing your mileage too quickly for runners. Hi, I'm Dr. Gage Winkles. I'm a sports chiropractor here at Health-Fit Chiropractic and Sports Recovery right here in Boca Raton, Florida. And today I want to talk to you about how you can gradually increase your mileage to prevent falling into the overuse injury cycle and putting a damper on your training as race season begins this coming fall in South Florida here. We like to utilize our 10% rule in office here, and that is as you progress through training, you gradually increase your load or volume by 10%. That will help you prevent you from falling into the overuse injury cycle that we see far too common in many endurance athletes and many runners, especially as they're beginning to train for season. What we want to avoid here is we want to make sure that as you're progressing through your training regimen and increasing, whether it be the amount of runs you're doing weekly or the total mileage you're doing weekly, that we aren't going from 5 miles weekly in that first week to 15 miles in week number 2 there. What we see happen when that occurs is we often find overuse related injuries, oftentimes things like muscle strains, in areas like the lower leg. And as you can see here, we have a lot of different muscles throughout the lower leg that can be affected by this. Sometimes we'll see things in the front of the lower legs around the tibialis anterior here that can cause things like shin irritation. A lot of patients will come in with shin splints. We can have things along the outside of the leg, such as the fibularis longus or fibularis brevis here, where pain will be felt along the outer portions of your legs. Or one of the other most common injuries we see in runners here involves our calf muscles here with the gastrocnemius. And you can see how that feeds right into the Achilles tendon here. And we will develop and see runners develop Achilles tendonitis, where that tendon becomes inflamed as it comes down to the back portion of the heel here. Now, to avoid injury to some of these lower leg muscles here, again, we're going to implement the 10% rule, and also we're going to promote proper exercise with running with strength training. We want to combine strength training with running, routine chiropractic care, and using soft tissue modalities such as active release technique to help get you out of pain, take away those minor aches and pains before they develop into something more serious. If you have any questions on how you can continue to train during upcoming race season here in South Florida and prevent injuries from happening, give us a call today and we'd be happy to chat. Take care.